1 in 8 women in the United States will develop breast cancer in their lifetime. That translates to millions of women battling a scary diagnosis. Well, here in the Gem State, those numbers could be higher than we think because, well, Idaho ranks last, 50th in the country for breast cancer screening. With October being Breast Cancer Awareness Month, it's time to encourage women to get that mammogram. But a couple of months ago, a Boise woman found out even with a proactive approach, there are some coverage gaps when it comes to insurance in Idaho. The bad news, a cancer diagnosis. The good news, that woman is lawmaker Brooke Green. And now she is making it her legislative quest to make it easier for others.
It was crushing. It was a crushing blow.
In August, Boise Representative Brooke Green announced that she would be stepping back from public life after a diagnosis of invasive breast cancer.
You know, not only am I now a cancer patient with breast cancer, I've also lost the opportunity to carry a baby through IVF. And so it's like, which one's worse, right?
Green was hoping to use IVF to expand her family, but her attention was quickly forced in a new direction.
I had a clear scan last year. I didn't have cancer on my scans last year. My cancer appeared within 9 months.
Green was able to quickly get into Lyra Total Breast Health in Meridian for more scans. It was a doctor there who pointed out something interesting.
And she shows me my imaging and she goes, here's your cancer on 2D imaging and here's your cancer on 3D. She goes, I can't see it with 2D imaging.
On the 2D, you cannot see her cancer. There's no doubt. I cannot see it.
Dr. Barbara White is a radiologist and co-founder of Lyra Total Breast Health. Through her work, she found a major gap in breast cancer care in Idaho.
A lot of women in Idaho are just given the option of having a 2D, and then if they want to have the 3D, then they have to sign paper that says they're going to potentially pay more if their insurance doesn't cover it. And what happens is a lot of women opt out of doing that and only get the 2D image. And so with that, they often don't have breast cancers diagnosed in a timely manner.
It varies from carrier to carrier, but Dr. White found often insurance just doesn't cover beyond a 2D scan if it's diagnostic.
And so what we're trying to do is get all coverage for all imaging for breast health in Idaho.
There are tools like contrast scans that can yield quick and crucial results, especially in patients with dense breast tissue.
What happens when you have dense breast tissue is the cancer is white, but so is the normal tissue is white. And so it's really hard, it's really difficult to determine, is there something going on? And when I do the 3D and I can scan through it on the 1mm slices, I can actually see this breast cancer here. But again, it's pretty subtle. And when I go to this is, again, the contrast enhanced mammogram, there's no doubt in my mind that there is an enhancing mass there.
That coverage could be the difference between life and death.
Representative Green's story is so impactful because we can see it right in front of us. So had she not had the best available initial screening, she would have had a diagnosis of cancer mid to late pregnancy, and that might have cost her life.
Dr. Rihanna Menon is the medical director of Mountain State Breast and General Surgery. She, too, is advocating for expanded insurance coverage in Idaho.
So what we want is contrast-enhanced mammography, MRI, 3D mammograms. We want all of these approaches that are just standard to be covered by insurance.
Through this process,
As Brooke Green dove into the topic, it became apparent that Idaho women and some men were faced with a cost barrier to coverage.
So are we going to choose between better imaging and enhanced prognosis, better prognosis? Or are we going to choose food? And so, the conversations I've started with insurance companies is what does the coverage look like for your insurer, and how can we expand that in preparation for, the legislative session, which is right around the corner.
Green is using her experience to try and push for change. One idea?
It would ensure that 3D imaging is covered. It ensures that the other diagnostic tools are also covered, and not just for preventative.
For now, Green and her family are focused on her health, a bittersweet reality that includes reflection on what could have been, but in the context of a crucial catch.
Cancer sucks. It's like slaps you in the face one day, and in 24 hours your life changes. In our case, it was our family. That was probably the hardest hit. Once I realized I was going to be okay, we realized how big of a deal this is going to be. So it's hard, but it's also therapeutic. If we can work to make good, positive change, then I'm helping somebody else.
And Representative Green is doing well, but she did tell me today she will be missing a portion of the beginning of the legislative session. She's scheduled for a surgery for a mastectomy and a reconstruction. Brian, when I spoke with her and her doctors today, one of the things that they cannot say enough here in the month of October, Breast Cancer Awareness Month, go get scanned, advocate for yourself, and make sure you're having a conversation with your physician, with your medical team, with your insurance provider, what is covered.
How is this a legislative thing? Is it the law that says that doesn't make insurance companies cover this type of treatment or scan?
Well, I mean, if there's nothing in the law that says they have to do that in Idaho, as Idaho insurance coverage carriers, they don't have to. So what this becomes a conversation of, do you have to mandate something to insurance carriers in Idaho? As you know, insurance gets a very tricky and complicated world, but the idea here is to start these conversations, and then hopefully there is a legislative solution. Representative Green, though, will find out firsthand what that could look like.
That might change the whole least regulated state thing, too.
Well,
Well, at least put a little nick in it, I guess. Well, we'll see. All right, thanks, Joe.